off of Facebook and back over to Zoom.
Okay.
Okay. Hi, Debbie.
Hi, how are you, Carol?
I am doing so great. And we are trying something new today, everybody. We're doing a Facebook posting of a Zoom meeting because we still want to be safe, even though the state of Ohio is opening up, and we want to be able to talk and be together, but not in the same room. So that's why we're doing this on Zoom. So hello, everybody, and hope you're having a great day. And Debbie and I are just going to talk about what we're doing and what I've done as a medical office to stay safe. And, you know, a lot of the things that I'm doing is what you're doing. So let's talk about you opening up, because we've been open for a week, and I'll tell you my experience after you tell me about the joy of what you're going through right now.
I don't know if I would say joy. You know, it's been a lot. You know, I know all of us are in this together. In the past, 8 weeks has been, so overwhelming. But we feel so confident. I've been on the Personal Service Advisory Committee, and we had 30 of us on the committee, all different sizes and shapes of salons and independent contractors, and small, big. We also had day spas as well as tanning and braiding. And we had the Ohio State Cosmetology School, and we also had a barber school, as well as 3 health commissioners. So I feel very confident, after coming out of that meeting and being able to present what we found and how we want to reopen safely. And I think the thing that really came out of it was everybody was so impressed with all of our education in our industry and that we're licensed. So many did not realize that, barbers have 1,800 hours to be licensed, and, hairstylists have 1,500 to 1,800 hours to be licensed. And a lot of that curriculum is just focused on sanitation.
There I am. See, I'm giving that feedback. Hold on a second. I'm just going to get off of here, turn that off. I don't know how to do it exactly. I'm afraid if I turn my Facebook off, it'll go away, but I don't know. We'll find out.
Okay.
It still says live on Facebook, so I'm good. Yeah. So
all this technology. Oh my goodness. Yeah.
But those hours are really, I want people from the state of Ohio to know how lucky we are in this state that we have that many hours, because not every state requires that much.
Yeah, Ohio is one of the largest states and really focused on that sanitation and ongoing education for us as well, with the hospital medical grade disinfectant with barbicide and leukocyde. And so I feel, I think the health commissioners were kind of impressed with all of that as well.
Yeah. So, and my experience before we opened up was just really going around and looking around the world at people who've already opened up safely. So like Singapore and Hong Kong, and how did they keep it so that they're not back where they're having to shut back down? Because none of us want to go back there again. But my biggest thing is I want my patients to be safe. I want my staff to be safe. And that's what they want as well, So there's some anxiety of coming out of our homes and doing some of this stuff that is normal things, like we all want our hair cut.
Yes. And I think it's, really starting to not really have a new normal, but a new now. So right now in this moment, this is what we have to do. But, in a month, it may be changing. So I think that's real important too, for us to all stay flexible and being able to know that, things will evolve. And that's, change is always hard for everybody, but, trying to have that flexibility and knowing that at any moment, we're going to be able to evolve, what we're doing and how we continue to stay safe. And what does that look like for everybody?
Right.
To really, open back up Ohio and get us back to what we love doing.
Right. And, the facts that we had in early March are different than the facts that we have today, and it will continue to be that way. And I think, we're talking about the new now, but I think we're all going to be better hand washers because of this. We're going to wipe
The
surfaces down.
golden
Like,
standard.
I don't think that's going to change, but probably the fact, like right now, we have people wait in their car and we bring them in and we wipe down the door handles immediately after we walk patients in, and we take them straight to a room. And, that may not have to continue once we have more knowledge about how to prevent the transmission of this disease. What do you see happening? Like when someone comes to Penzone's now to get their hair cut, how are they going to enter the building?
Well, we're very fortunate. So with the Ohio State Board of Cosmetology and Barbering, they are actually guiding us now. So they will be really, mandating this protocol and helping us. So they are supposed to work with the Health Commission and put together a one-page printout that any salon owner or stylist can print right out, and you'll be able to put it right on your door or right at your station. And it really guides the guest to know that, what you need to know before you walk into this facility. So I think those guidelines and those bullet points are going to be very important for everybody to see before they even enter into the salon space. And just like you don't want, if you don't have a waiting area and you can't do 6 feet of distance, then yes, that person might have to wait in their car until that moment. And 2, really knowing your maximum capacity. So we cut our team down to half. And we opened up our hours. So we're extending our hours in the morning. We're starting at 7 in the morning and we're going to 11 at night. So we opened up our hours and spread out our staff. So we will be operating every single location at 50% less people. So we know that we'll have the space to spread out and, really have that really, slow, safe opening that we're all going to feel so comfortable delivering. But the one really cool thing is we're going to have the same amount of team up front. So with half of the staff in the back, we're going to have the same amount of team up front, and they are charged to sanitize, wipe down, help everybody, and really help us with some of the mobile checkout now that we'll be doing. So we're trying to, not handle cash and put the tip right on the credit card. Of course, if a customer wants to hand that artist, cash, that's perfect. But we're trying to really reduce some of those touch points.
Yeah, I'm with you on that. We've been open for the last week, and the nicest comments we've had is all this preparation that you're talking about, having less people in the building at the same time, making sure everything gets wiped down. In fact, when we bring someone into the office, we actually take them right to the bathroom and have them wash their hands.
Yes.
And then that way we know, we're washing our hands, their hands have been washed, and as things get touched, we're doing the very best that we can in terms of wiping it down immediately after. Physically in our location, we have closed doors to our rooms, but I'm thinking you probably have altered some of your very beautiful award-winning spaces.
Yes.
So what have you done?
Yeah, well, we're still working on it right now. So, we're looking at some of the spaces. We're fortunate to have the space, but we've gotten some of the plexiglass shields, and they're on wheels. So they're really nice. They look, really modern, and we can place them in certain areas around the styling areas or around the social rooms. So we can have that space and that distance. So, and even with the nails, we're looking at the plexiglass that you can, set up in between the nail professional and the client. So we're looking at things like that too to help. Which I think is going to be, really nice. Some salons might not have that space, or might not have the 6 feet different distance space. So if they put up that barrier, that will help them to be able to open safely and be able to start their business back up. And on that committee, that was something that was so important for us, is that we had to think about each and every way that we deliver personal service. And there's so many different types of business in our industry, like yours, that we wanted everybody to be able to do it safely and not have to invest a lot of money or, but safety would be the number one thing to think about between that client and that personal service provider.
Yeah, one of the things that we, so you talked about change. And so after we opened up, one of the things that really became apparent to us is we have something called a Zimmer cooler, and it blows cool air instead of hot air like a hair dryer does, but on the skin. And then we started thinking about, well, what is that doing in the area? So talk about blow drying or drying hair in a salon. What's your thoughts on that?
Yeah, the committee, 100% with the health commissioners, did not feel like that was anything that we had to stop doing. So
Well,
that was brought up in the committee. And I know some states are not blow drying hair. So, I mean, that's a hard thing too, because just like our license, every state is different. So
mhm.
it would be so nice if everybody was the same, but every state is different. And all of the state boards of cosmetology require different things from each licensed person in each different state. So it was really interesting because on the committee, we had some franchise owners that have salons in different states that are already up and running. And they might be a couple of different states. And those states had all different mandatory regulations and best practices.
Mhm.
So that I think that every day it seems like it's changing as well, and hopefully we just continue to stay up on top of the latest and greatest information for safety for us.
Yeah, and I think that's so important is just the constant looking at the information. I know what gave me comfort because, when we heard that we could reopen too, then there's the fear of our staff and are they going to be comfortable and things like that and looking at what other people did, but also talking to my friends here in the state who work in emergency departments. So they're seeing patients who are known COVID carriers who are very ill.
Yeah,
And really, they said, so long as in that situation, they're wearing their masks and doing the appropriate personal protective equipment, washing hands, wiping down surfaces. They haven't seen any very ill patient to provider transmission.
yeah,
So I felt much more comfortable after talking to people that that's the situation. I had hoped that we would see that, maybe there were more people with the antibody testing, and I think that's important right now, is that the antibody testing we have right now is not perfect, and they're going to get more perfect as we go forward. But as we look at the antibody testing that's currently available, we're not seeing that the population has been massively exposed to this yet.
yeah,
So I think that's a message a lot of people are wondering, how many people have actually been exposed.
yeah. And
Um,
don't you feel so proud of Ohio? I mean,
oh
I
my
am so
gosh.
proud of our state. Everybody all over the United States is like, wow, Ohio is doing it the right way. When we closed on March 15th, I believe they said we were the first salon in the United States to close, and our governor, was the first one to close, and now we are the last one that's, opening back up. So I feel like, we have really done things the right way and taken our time and been intentional. I won't forget like the Arnold Classic, remember?
I
I mean,
do.
we closed that down before anybody thought to do that. And I think that really helped us here in Ohio to stay so strong like we have been.
I agree with you. I couldn't be prouder of our governor and Dr. Acton. And I know not everybody feels that way.
Yeah.
And I would say people who are in high risk categories are probably going to be more cautious
Yes.
than people who are not. And that's what they
Yeah.
find throughout
Yeah.
the world.
Yeah.
So
Yeah.
that's
Yeah.
not
Yes.
anything new or
Yeah.
different.
Yeah. And I'm sure a lot like you, the 15th, we are allowed to open. It's not mandatory. So if a salon or a spa or a day spa doesn't feel like they're prepared or ready or want to open, it's okay. And without judgment, I think we need to support each other. We're all in this together. And if my neighbor down the street doesn't want to open their place and they want to wait a little longer, I'm not judging them. I'm going to be like, okay, well, that's what you feel that you need to do. And I think, that's something that's, that positive light of we are in this together and let's help each other without that judgment is so needed right now.
I agree. I just want my hair cut. That's all I
I know. I know. Me too. Look at that. Oh, it's so bad.
Well, that's great. Anything else that you want to do to reassure people that safety or anything else you think people are anxious about getting back and doing some of these things? Like the state of Ohio, we talked about how progressive
Yes.
they are.
Yes.
Everybody's going to be wearing masks
Yeah.
at your
Yeah.
your
Yeah.
stylist.
And to know with us, again, the Ohio State Cosmetology Board and Barbering Board, they regulate us. So they do inspections all the time. So I know, like with you, with hospitals and the healthcare, the health department doesn't come out until somebody complains. In our industry, that's not true. They come out all the time and inspect us and make sure we're doing the right thing. And really, because they're there to protect the health and the safety of the public. So I think that's really powerful for us. We've always had a professional cleaning company that comes into our facilities every night and they clean. And I feel so confident with that, knowing that now they are up in that game to the highest level of hospital medical grade sanitizing. But then our team is empowered every 15 minutes to every half hour to be wiping down and cleaning. And we've removed anything that cannot be disinfected. So I think, I feel very confident with that, and our team, really working with that, our facilities and our cleaning, our disinfecting, and we as licensed professionals, just like you, I'm sure, we've always had to disinfect our combs and our brushes and our scissors, a shampoo bowl, our chair, and anything was supposed to be disinfected and cleaned between each guest anyways.
Yes.
So it's that heightened awareness now that I think people that maybe weren't doing that will take the time to really do it now. And we've even put time in between each guest so that we can have that time to do that. And even like disposable capes so that every single person would have a cape that's theirs. Or we got some capes that can be washed and cleaned and sealed so that we know that they are clean for that, that next guest, and everyone that you use is ready to go. So yeah, there's, probably, I can't even imagine the list right now, how many steps that we've looked at, but it's really been a good time, I think, for all of us and all of our industries to look at all those procedures that you do each and every day and take the time to reevaluate it and shine that light on it, how important each team member is to help you in that, taking care of the environment.
Yeah. Well, this is going to be a lot of fun, and it's a lot of work to get back up and get going. And so I just wish you the best, and I just appreciate you taking time. And I just want people to start to feel comfortable going out in public and going to places where people are doing the appropriate distancing, mask wearing, wiping things down, and hand washing. I think we're going to be okay. And at some point we'll get, more massive testing, and we'll have, even safer healthcare precautions that come through our public health department. So it's just going to keep evolving, but it is time for us to get out and get going again.
And we're going to have really early mornings, like I said. So, for anybody that might feel they're at risk or, have, some of those, risks that they have to be aware of, 7 in the morning, we're going to be in there, and it's going to be dedicated to anybody that would, want to really come at those times earlier in the morning, which, I think that the more that you can open up and expand your schedule and be there for people, that's going to be nice for them to feel comfortable that they have that time.
And we did that, the 7 a.m. and we have found that it's a very popular time and definitely expanded our hours. We were doing some Saturday hours. They're much longer now. And I think people will just feel safer, and we know they'll be safer if we keep that distance between people.
And we open up the 15th, but we're taking the first 2 days, the 15th and the 16th, just for our professionals and artists and team to come in and take care of themselves with each other, but actually kind of just run through everything because they haven't been in there in 8 weeks. So really to walk through all the procedures, and after they've done their training, and feel confident when we open up on that Sunday, the 17th, for the guests to come in. So I think that's really important too for us. We're taking that time to really make them feel comfortable, because they say, there's a lot of stress, of not being at work, and then all of a sudden you have to go back, and with everything else that we have to be aware of, it's nice to be able to give them some time to come in and feel comfortable with some of the new procedures and be able to ask questions.
Yeah, I agree with you. So That's great. Well, it was good seeing you today. And hopefully we'll see you doing some yoga online again soon.
It's really helped save me through all of this. I don't know what I would have done without my yoga and my meditation.
Well, good. Take care. Thank
Thank
you so
you.
much. Bye-bye.
Bye-bye.